Hi everybody, Dr. Carolyn Coker-Ross here today to talk with you again about intergenerational trauma. And we know that it can have a lot of significant effects on the brain, often causing changes in brain structure and the functioning of the brain. And some of these changes that have been observed in research include the feeling of hypervigilance, a hypervigilant stress response, so being on red alert all the time. So intergenerational trauma leads to alterations or changes in the part of the brain called the amygdala and the hippocampus. And you'll see on the diagram where those two are. And these are areas of the brain involved in the stress response and in our ability to regulate our emotions so we don't go too numb or too over the top. And this heightened vigilance or red alert can really cause difficulty in regulating emotions. And the second thing that's changed in the brain is the prefrontal cortex, which is responsible for decision making, impulse control, and social behaviors. And these can also be affected by intergenerational trauma. So this can lead to difficulties in being able to make decisions, which we call executive function, rational thinking, as well as impulse control. And then the third area that's changed are the levels of the feel-good chemicals in our brain, which are called neurotransmitters. And trauma can have an impact on those levels of, for example, serotonin and dopamine, which are both involved in mood regulation and pleasure. So whenever there's imbalances in these neurotransmitters, that can cause symptoms, for example, of depression, anxiety, and other mood disorders. And we've talked before about one of the other changes, which are epigenetic changes. We know that trauma doesn't change our DNA, but it can change the expression of genes. For example, genes related to the stress response, genes related to depression, anxiety, substance use, eating disorders, as well as many medical conditions. These changes then can be passed from one generation to the next, and then that perpetuates the cycle of trauma. So to address these changes, we have to promote healing of the brain. We don't think about that very much. We think more about healing the body, but it's important to heal the brain. And we can do that with different supplements, complementary alternative therapies, and more. So I want to show you a few examples. The first is omega-3 fatty acids, and this is a brand that I know and love, Nordic Naturals, and this one contains both what we call EPA and DHA. So omega-3 fatty acids have been shown to have protective effects on the brain and may also help reduce symptoms of depression and anxiety. So I really recommend 2,000 milligrams of combined EPA plus DHA of the omega-3 fatty acids. The second way we can work to heal the brain is through mindfulness and also mindfulness meditation. I've given you a number of meditations to use and practice that I myself have used in the past. And we know from studies that meditation is very effective in reducing stress and improving our ability to regulate our emotions. Regular practice is what it takes. And with regular practice, whether you're using a recording like the ones that I've had in these videos, or something you've gotten over the internet, that can help you become more aware of your thoughts and emotions, allowing them to respond to stress more effectively. So the next one is yoga. And yoga combines physical postures as well as breathing exercises to really help you learn to be more mindful and more present. There's even a type of yoga that was developed in part by Bessel van der Kolk, the author of The Body Keeps the Score, a trauma book. And trauma-informed yoga is really useful if you have had childhood or even adult trauma to help coordinate the symptoms or triggers that you may have in your body with your breath work. And it's been shown, yoga has been shown to reduce symptoms of post-traumatic stress disorder, depression, and anxiety. And I think the reason why it does help is because it connects the mind and the body, promoting relaxation and stress reduction. Number 4 is something that many of you may have heard about, but maybe not all of you, and that's a direct trauma therapy called eye movement desensitization and reprocessing. That's a mouthful. Let's just call it what we all call it, which is EMDR. EMDR is a type of trauma therapy that helps people who've experienced childhood trauma or even adult trauma process those traumatic memories and those triggers, and help also to reframe negative beliefs that can result from trauma. We're talking about beliefs like, I'm not good enough, I'm not worthy, no one will love me unless fill in the blank. So it's kind of hard to explain, but it involves a stimulation of eye movements or tapping. So sometimes they use a light to make your eyes follow the light back and forth. It's very unusual, but it really, really works. And I think it's something to consider if you're struggling with nightmares or you have flashbacks of trauma in particular, or you just feel stuck and can't seem to get past your trauma. And then another type of therapy that I'm a big proponent of is acupuncture. And acupuncture is a traditional Chinese medicine practice that's been around for thousands of years. And I'm sure you've seen the pictures where they're tiny little thin needles in different points on the body. Those are like energy points. They call them points along the meridian. And it helps to move energy that may be stuck in certain parts of the body, and therefore may lead to depression, anxiety, stress, trouble sleeping, etc. So it's been shown in research to reduce symptoms of depression, anxiety, and post-traumatic stress disorder by, number 1, promoting relaxation. It's hard to believe you can be relaxed with needles in you, but it works. And it also restores balance to the body's energy flow. So if you haven't tried acupuncture before, I'd recommend it. In most cities, there is an acupuncture or a traditional Chinese medicine school that you can access. Another thing is a type of supplement that we use to help the body deal with stress. And those supplements are called adaptogens. So I have one here that's a mixture of adaptogens that I really like. It contains rhodiola, it contains cordyceps mushroom, and ginseng. All adaptogens that can help regulate cortisol levels and promote relaxation. There's many, many different brands, but I always recommend that you choose a well-known brand. Like Zymogen is one. There's others that are well-known. And then therapeutic art and music. Now, I'm not any good at art. I love to dance to music though. But if you are interested, things like painting, drawing, or playing a musical instrument can provide kind of a creative outlet to help you process emotions and reduce your stress. Art and music therapy have been well validated in research and are often used to help people who have experienced trauma. It helps you express yourself in a different way than just talking, and therefore it can tap into those more emotional parts of the brain, like the limbic part of the brain, and that's where a lot of the traumatic emotions are stored. So that helps you really explore your feelings in a safe and kind of supportive environment. So it's important to note that while the supplements and activities and therapies that I'm mentioning are well researched and can be, very helpful in helping you interrupt that cycle of trauma from one generation to the next, and they can help promote healing, but they're not ever meant to be a substitute for professional help. Especially if you're using supplements like I mentioned in other videos, you should check with your physician or your naturopathic doctor before you use it, because you may be taking medications that conflict with the supplements. So if you are experiencing intergenerational trauma, it's really important to get support from a qualified mental health professional who can really guide you and direct you towards a more individualized or personalized plan for healing your trauma. I hope this was helpful, and I will see you next time.